So that was the basic study we did, and that was actually presented in Glasgow 10 years ago. It was just published at that time. At that time, I said, we're going to go now into a study to test it in implants placed with sinus floor elevation procedures, a very demanding clinical situation. And you see, this is the technique we are using. This is the lateral window technique or an osteotome technique. And you can, of course, only do it when you do a simultaneous technique. And most of the cases we do with a lateral window technique simultaneously with implant placement. And here I show you a case we did in 2011 as part of that study. You see a very difficult situation, not a lot of bone height available. The first premolar, still visible on the radiograph, has been removed. And there, of course, implant placement was not so difficult, but in the second premolar, the first molar side, the bone height is between 2.5 and 5 millimeters. So we did the surgery with a lateral window technique. We put in 2 implants, one in 14 and one in 15. And we did then sinus floor elevation with a composite graft. That means autogenous bone chips mixed with DBBM, also bovine bio-os. And you see the second implant had very low ISQ values, 46 and 39, which is far below any threshold. Of course, we did not intend to go for immediate loading here, so we did a submerged healing. So we put a membrane on top to keep the soft tissue cells off our bone regeneration area and went for a primary closure. 2 months later, we did an uncovering of both implants and moved on for a provisional restoration. And we were very astonished to see that our second implant in area 1.5 already improved tremendously from 46.39 to 63.71. Now we decided to go into a restoration because we had 2 implants and we could splint them. And we did a provisional restoration, which were implant and tooth supported for another 4 months. And here now you see November 2011, then we opened up again and put in a third implant. So that was the implant in area 1.6. And that implant showed then an ISQ value of 67 and 61. And we let it heal. 5 weeks later, we already recalled the patient to see where we are, because he wanted to have a better provisional prosthetics for the Christmas party. You see that tooth number 17 has been removed then. And you see the ISQ is now 77. Look the quality of the healing. So everything is fine. So here you see the patient 2 years later, all 3 implants very well integrated, all restored with a single crown. And the ISQ has been extremely useful here to make always the necessary decisions when to move on. Then I show you an extreme case. I have not seen many of cases like this. This was a case we did an implant placement in 1.6, and we had only an ISQ of 30, very low. So we went also for submerged healing then. You see here what we have. This is the mixture of autogenous bone and bio-os as a composite graft. And then 9 weeks later, so we missed the 8-week follow-up period, for I can't remember the reason. We did a reopening and then we measured, and we were blown away to see that actually this implant had an ISQ of 70. So improved dramatically. And look here, the radiograph. You see then, this is the post-surgical radiograph, and you see how well the bone has already healed, complete consolidation, and we have a 70. So we decided to go ahead and restore the case. And here you see now the patient 3 years later, and you see this implant is doing extremely well, 3 years follow-up. In the meantime, the second molar has been removed in private office, and you see how well remodeled the bone seems to be. Then the last case I want to show you where we had to extend healing periods. You see, this was again a distal extension situation, and the first premolar had to be extracted. And you see again in the first premolar side, the height is quite okay. In the second premolar side, the height is now about 4 millimeters. So we put the two implants in, and you see that the second implant has only an ISQ of 44-55. Very typical often in sinus floor elevation procedures. So we put a membrane on, you see, and you see the case was treated 8 years ago. You see the second implant, of course, this is only pristine bone here, and this is all area with, of course, not augmented bone, that's not yet regenerated. This is just the composite graft. So at 8 weeks, the value was 53.65. So I was not very happy with it. You see, I said, we're going to wait. At that time, for the study, part of our study, we did another reading. 2 weeks later, it moved up to 68, and at 12 weeks, 71. It's nicely to see that the ongoing bone healing and the bone remodeling increase the density of that bone, and the ISQ goes up. It shows how sensitive that technique is. Okay, the paper then published 109 implants in 97 patients, and you see average age 63, and you see here the ISQ values at day of surgery. This is here, and you see the mean value was 67, the median value was about 73, but you see a lot of outliers here, including the case with 30. And here then 8 weeks later, the mean value went up to 73. The median is 74. And you see, of course, the standard deviation is much smaller, but we still have a few outliers. The threshold would be 70. Okay, that's what we measured. Here you see now all these 109 measurements, and you see that, of course, the curve most often goes up, but not in all of them. So when we measured now at 8 weeks, you see we figured out that 83% of all implants showed an ISQ of 70 plus. So these 83% got the green light to go into restoration. Now the loading, of course, does not start 8 weeks because most of the patients are referred back into private office, and then goes another 1 or 2 weeks before then the implants are restored. Here you see now when we take them apart, the left graph shows all the values going up above 70. These here are values where actually the numbers goes down, but of course these are very high values, 85, a lot of primary stability, probably cortical bone, goes down, still 80 or 79. And these are the 17% of implants that actually did not reach 70 at 8 weeks of healing. And you see now 8 weeks, 10 weeks, 12 weeks, 16 weeks. You see how the ISQ values go up. So that shows the potential of this technology. So the conclusion was that 83% showed an ISQ value of 70 plus at 8 weeks, one early failure in the whole group, that's a 0.8% early failure rate, and that ISQ has been a very effective diagnostic tool to monitor implant stability over time. And that's the big advantage when compared to insertion torque. Okay, so you see in our patients today, and not many groups are doing that, I tell the patient when we do a sinus graft, we try to restore your implants after an 8-week healing period. We have to measure ISQ, and when we have a value of 70, we go ahead. If it's not 70, we wait. Patients love that, because when I show them the value, it's only 64, they say, yeah, professor, we wait. Exactly as I say.